Hi, so I am here to talk about the Chapter 9 Challenge Yourself questions at the end of the chapter. And if we go question by question, if we look at number 1, it's asking if we attended a meeting of my organization's Healthcare Ethics Committee in which an ethical conflict that the organization is facing will be discussed. So, and then ask, how will I prepare myself? So, if I was thinking about like a real life scenario and I was getting ready to go to this meeting and I would need to prepare myself for the meeting, first I would probably look at the specific organization's ethical statement. So much like the one that we're writing a personal one for, I would look at the organization I worked for to see what their ethical standpoint and viewpoint was. It might be different than my personal one, but at least I would be prepared and know what the organization as a whole stood for. I also would want to review the ethical decision making process, and I might even want to bring that with me just to know like the steps I need to take to, or that we need to take as an organization to get to an answer. So, for example, I might want to know what to listen for. I would probably want to take notes, ask questions. I'd want to participate as much as I could. I want to gather a bunch of facts. And so some of the things that I could use using the ethical decision making process, I could look for the problem at hand, the question that we're asking in this specific situation. Also, it'd probably be a good idea to know what stakeholders are involved in the ethical dilemma, internal or external. And then maybe towards the end we'd be able to come up with different options to solve the ethical dilemma. But the meeting may need to have like another meeting to talk with more detail. It might not be able to be made in that quick of amount of time. The next one, the chapter talked about beneficence possibly having a negative implication, and they called that paternalism. So I understood that as like a nurse or an assistant might be doing good for someone. They're not causing them harm, but they're not taking their autonomy into consideration. So they're not taking their own choices. And I could see this happening in like a long-term care facility setting, like the nurses or caregivers are acting with good intent, but they're not asking their patients what they really want or prefer. So it's kind of hard for me to come up with another example like that one. That was really good, but I was thinking autonomy could maybe have a negative implication. I thought, so for example, a patient may choose a treatment plan that is not ideal because it is their choice. However, they may need more education on their diagnosis or their treatment plan rather than just letting the patient make their final choice. So it is important to let the patient have their own choice and autonomy in making decisions about their health care. But sometimes patients may not take into consideration other things that we've given the patients, or maybe they're just not educated enough to understand. And sometimes we have to step in even though they're making a decision at the time. Another one I thought maybe could be justice. Justice might have a negative implication, and it kind of just depends on someone's viewpoint. Like, I might think this may be a negative implication and someone else might not think the same thing. But for justice, I thought for patients who are in a vegetative state and cannot make decisions on their own and are living on life support, most of the time that situation gets kind of hairy for the patient and their family members. And I thought when justice could come into play when they're trying to decide if the patient should keep living on life support or they should like pull the plug. And I thought, is it justice for the patients that they're focusing on or justice for the family members that are being left behind? And most of the time that ends up being in the hands of the family members because the patient can't make their own decisions. So yeah, I don't know if I could really call it justice for the patient. It kind of depends on the family and if they take into consideration what the patient wants to. So if we move on to the next question, it talked about 3 different situations involving decisions, and all of these decisions could potentially be what like a future healthcare manager could make on like a normal basis. This could be like a normal decision that they could make. So then the question asked, which of these decisions involve ethical conflicts? And so I was supposed to pretend I was a patient safety officer, and I needed to look at these decisions and see if they might harm patients or they have some kind of ethical content to them. So for each of the different scenarios, I thought there could potentially be an ethical conflict in either of them. It kind of just depends on how you read the question and read into it and assume things, and like you can't ask questions. It's just like a couple sentences. So the first one was talking about the healthcare manager needed to make a choice among several software packages, and the manager thought that they couldn't do it on their own and they needed a consultant to help pick one. So I thought this could be an ethical conflict between the consultant, because that consultant could potentially steer the manager in a specific direction, and this could have them possibly pick an unethical software or an unsafe software for patients if you just let the consultant make the main decision. Also, the second one, so this is where the manager already made the decision. They decided to make the purchase of the software package, but it went over budget. So instead of trying to find a different software to be in the budget or look into the budget and try to get a higher amount approved, the manager decided to split the order among 3 different purchase orders. So the person is kind of fibbing on how much and at what time she spent that money to make it look like she did really good within that budget. So that's definitely an ethical conflict, because the manager's not being honest. She's not being she's not being trustworthy in her position as a decision maker. She's making it look like she's done really well, but in all reality, she's lying about how much she spent. So then the last scenario here on this question number 3 is, so you want to evaluate the software package that the manager decided to get, and the vendor that sold her the software package just said, hey, I'll take you to Florida and we'll go over this software together. Well, just like the first scenario, this could also be an ethical conflict, because that vendor could be misleading, and that person could be feeding this manager a lot of information that makes that software look really good. And most of the time you need to look at it from an objective standpoint, and you can't just take what someone else says at face value, especially if they're biased towards that specific software. So I think that could really happen there. And then the final question was talking about the difference between clinicians and healthcare managers' ethical obligations in their field. And it says that clinicians normally focus on like the individual patient, and the managers have to focus on the group of patients, not just each individual patient. And then I just kind of thought that managers, they have to look at a whole different perspective of the organization. They kind of have to look at it from a business perspective rather than just each individual patient. And they have to take into account so many different aspects that go into the business, such as like finances, planning, organizing, so many different decision making or decisions that have to be made that aren't just patient specific. So I said that most of the time clinicians can do this too, but managers have to look from a utilitarian viewpoint, and they most of the time have to make the best decision for the greatest number. And sometimes this may not be good for a small group of patients, but they have to make a decision at some point. And that's kind of their role. They have to make these hard decisions, and sometimes not everyone will be happy, but if the managers make a decision for like the best decision for the biggest number of people, then I feel like they've done their job. And clinicians, they have their own each individual patient that they're looking at each day at a time, and clinicians might take the manager's decisions that they might not like it either. So it's hard. Ethics is hard to talk about, to understand, and to like move forward with it in a business. So that's it.